Good day, everyone. We are the Group 2, and today we will do a report about sexually transmitted infection and urinary tract infection. Our learning objective is at the end of the laboratory period, students should be able to develop the skills in analyzing cases pertaining to infection of STI and UTI. Sexually transmitted infection is a disease that has increased tremendously through the years. The age increase not only in adult but also in adolescents. STI are mostly caused by mixed infections and not just single organism. The infection transmitted through unprotected sex, vaginal, oral, anal, skin-to-skin contact with the genital area and blood transfusion, or perinatal transmission through placental transfer during childbirth as the infant passes through the infected birth canal.
Clinical manifestations of sexually transmitted infections. Skin lesions. First is ulcerative lesions. Under ulcerative lesions is cancre. This is a primary lesion of syphilis, painless, and well delimited. Second is cancroid. This is ulcer with rugged edges or painful. Genital herpes start as a vesicle that becomes an ulcer after rupture. Second lesion is granulomatous reactions, typical of granuloma inguinale. Third is rashes, commonly seen in secondary syphilis, gonorrhea, and candidiasis. Fourth is warty lesions, characteristics of condylomata acuminata and molluscum contagiosum. Discharge, vaginal discharge, usually accompanied by dysuria, dyspareunia, and vulvar irritation. Under vaginal discharge, we have Trichomonas vaginalis. This is thin, foamy, and foul smelling. Second is Neisseria gonorrhea. This is greenish and purulent. Third is Candida albicans. Texture is thick, cheesy, exudates, or like a milk curd-like appearance. And second discharge is urethral discharge. In males, any urethral discharge other than ejaculation is abnormal.
The syphilis ranked third among the most common sexually transmitted diseases worldwide. The causative agent in these diseases is the Treponema pallidum, a spirochete with fine regular coils with tapered ends. This organism is strictly human pathogen. It is sensitive to oxygen and cannot be grown in cell-free culture medium. The syphilis can be transmitted through direct sexual contact, congenitally, and through blood transfusion. We have two types of clinical findings, the adult syphilis and congenital syphilis. In adult syphilis, we have primary syphilis, a highly infectious stage with abundant organisms that can be isolated from ulcer. The primary lesion is called the chancre, which is painless papule that later becomes an ulcer with smooth and well-delineated borders. Next is the secondary syphilis, presents with flu-like symptoms, lymphadenopathy, and mucocutaneous rash in the palms and soles, which can be macular, papillar, or pustular. The lesion is called condyloma latum. And latent syphilis is the stage where the patient is clinically inactive or asymptomatic. And in tertiary or the late syphilis are characterized by granulomatous skin lesions or gamma found in bones and other involvements such as cardiovascular and central nervous system. And in congenital syphilis, we have right after birth. The infected newborn may manifest with runny nose, rash, and condylomata lata, as well as hepatosplenomegaly. Late congenital syphilis may manifest as 8-nerve deafness with bone and teeth deformities. In laboratory diagnosis, we use dark field microscopy and serology, and for the treatment and prevention, the drug of choice is the penicillin. Alternative drugs are tetracycline and doxycycline, and there is no vaccine for syphilis, so the other ways to prevent syphilis is to be controlled through practice of safe sex and regular testing.
Let's proceed to gonorrhea. It is the second most common sexually transmitted infection worldwide. It occurs only in humans and has no animal reservoir. Females are asymptomatic carriers of the infection. The risk after single exposure is higher in females, which is 50%, while in males it is 20%. It is caused by Neisseria gonorrhea, and it is gram-negative diplococci. It is kidney bean shape when it is single, and coffee bean shape when in pairs. Also, it has pili which are used for attachment to host cell, motility, transfer of genetic materials, and important in pathogenesis. Clinical findings. Rectal and pharyngeal infection are more commonly asymptomatic than genital infections. Disseminated infection occurs in 1 to 3% of cases. Fever, migratory arthralgia, suppurative arthritis of the wrists and ankles, and pustule with erythematous base over the extremities. Other diseases associated with perihepatitis or Fitz-Curtis syndrome, purulent conjunctivitis in adults, and it is ophthalmia neonatorum in newborns that causes purulent infection that acquired upon passage through infected birth canal. Laboratory diagnosis. Gram-negative intracellular diplococci in microscopy and Thayer-Martin medium, selective media allows the growth of Neisseria only. Treatment and prevention. Uncomplicated gonorrhea, ceftriaxone, ciprofloxacin, cefixime or ofloxacin. For mixed infection with chlamydia, drug must be combined with oxycycline or azithromycin. Prevention of ophthalmia neonatorum is 1% silver nitrate or 0.5 erythromycin or tetracycline eye ointment. Also, education of the public and screening of sex workers are effective control measures for all sexually transmitted diseases.
LGV, laboratory diagnosis. The organism can be visualized using GEMSA stained specimen obtained from the scrapings from the lesion. Culture is the most specific diagnostic method. Treatment and prevention. Giving of azithromycin, doxycycline, and erythromycin. Chancroid. The etiologic agent is Haemophilus ducreyi, a gram-negative Coccobacillus. Haemophilus means blood-loving and must be grown in culture medium containing blood. It only requires hemin, X factor for the growth, which is derived from the blood in the culture medium. Clinical findings. Chancroid presents with a soft, painful papule with an erythematous base that develops an ulcer with a rugged edge associated with inguinal lymphadenopathy. Laboratory diagnosis. Definite diagnosis is made through culture on at least 2 kinds of enriched media containing vancomycin. Treatment and prevention. Antibiotics for treatment include cephalosporins, azithromycin, erythromycin, and cephaloxacin.
Genital herpes. Genital herpes is caused by herpes simplex virus. It is a DNA virus under the family human herpes viridae. There are 2 types of HSV, type 1 and type 2. The virus is capable of latency in the neurons, hence the occurrence of recurrent infection. Mode of transmission. The main mode of transmission is through oral secretion or sexual contact. Clinical findings. Genital herpes is caused by HSV, type 1 and type 2, but majority of cases are caused by type 2. Most primary infections are asymptomatic. The lesions are very vascular, which later on rupture, resulting in the ulcers and are painful with inguinal lymphadenopathy. The lesions are seen in vulva, vagina, cervix, and are accompanied by pruritus and mucoid vaginal discharge. Recurrent infections are often of the shorter duration and less severe than the primary infection. A consequence of genital herpes in newborn is neonatal herpes, which is acquired through urethra or upon passage through the infected birth canal during delivery. Laboratory diagnosis. Sang smear and his pathologic examination are done to demonstrate the characteristic of cytopathologic effects that include Cowdrey type A inclusions, syncytial formation, and ballooning of infected cell. A more specific diagnostic test is PCR or immunofluorescence. Treatment and prevention. The drug of choice is Paxlovid, but it does not prevent recurrence. The prevention is the same with other sexual transmitted disease. No vaccine is available. Condylomata acuminata. This is caused by the human papillovirus. It's a virus under the family of papilloviruses that is transmitted through sexual contact. HPV is capable of immunotalizing or transforming an infected cell leading to malignancy. Clinical findings. Genital warts or condylomata acuminata occur most commonly in genital anal areas. The serotypes most commonly associated with condylomata acuminate serotype 6 and 11. Infections of the genital tract is associated with the cervical and perineal cancer. The serotypes predominantly isolated in these cases are serotypes 16 and 18. Laboratory diagnosis. Injection of interferon is the preferred and most beneficial treatment. An HPV vaccine is already available for individuals 11 years old and above. It is recommended for adolescents and sexual active males and females. It is either a trivalent vaccine containing serotypes 6, 11, 16, and 18 or a bivalent vaccine containing serotypes 16 and 18.
Acquired immunodeficiency syndrome AIDS. AIDS is caused by an RNA virus under the family of retroviruses called the human immunodeficiency virus HIV. The virus possesses the enzyme reverse transcriptase that allows it to integrate its genome into the host cell's DNA. It possesses a glycoprotein known as GP120 on its envelope that binds to the CD4 plus receptors on helper T cells and macrophages. Another envelope, glycoprotein GP4I, facilitates the absorption of the viruses to the CD4 plus T cells. Mode of transmission for HIV namely, first sexual, second blood transfusion, tattooing, ear, piercing, and injection. Third, transplacental contact. HIV is not transmitted by kissing, coating, sneezing, insect bites, or swimming pools. Individuals at highest risk of developing infection includes first sexually active individuals, especially those with multiple sexual partners. Second, intravenous drugs user with sharing of needles. Third, patient receiving blood and blood product transfusion like hemophiliacs.
Urinary tract infection is the most commonly encountered infection. UTI is common in women than men. There are 2 routes by which bacteria can reach the kidneys through bloodstream and ascending infection from the lower urinary tract. The most common route is by ascending infection. The urinary tract is protected by the frequent urination that flushes away pathogenic organisms, the acidity of the urine, and the constant sloughing of the epithelium. Metabolic disorders like diabetes, trauma like catheterization, improper use of tampons, and anatomic abnormalities of the urinary tract can predispose an individual to develop urinary tract infection. UTIs are commonly caused by the indigenous flora of the human body and its tubules pyelonephritis. The most commonly employed method diagnosis of UTI is urinalysis. The best specimen is early morning midterm catch urine. The definitive diagnosis is culture. A colony count less than 1,000 ml indicates contamination. 1,000 ml to 100,000 ml is possible bacteriuria, and more than 100,000 ml urine indicates significant bacteriuria. Trimethoprim sulfamethoxazole is effective for uncomplicated of UTI. A 28-year-old seaman consulted a physician because of a solitary nodule on the shaft of his penis that is hard and painless, accompanied by painless enlargement of his inguinal lymph nodes. The nodule later formed an ulcer with smooth edges. What is the most probable diagnosis and the most likely etiologic agent? LGB, and the most likely etiologic agent is Haemophilus ducreale. And letter B, give two other conditions that can present with a lesion like what is presented by the patient. How are they different from the case presented? LGB, painless papule and enlarged lymph nodes. Chancroid, painful papule and inguinal lymphadenopathic lymph nodes.
Number 2. A 25-year-old sexually active female sought consultation because of burning sensation during urination. She also complained of frequency and urgency in urination. The attending physician is thinking of probable urinary tract infection. Letter A. Enumerate and explain briefly the factors that can predispose the development of UTI. The factors that can predispose the development of UTI is gender and mechanical factors. Gender, which is UTI, is more common in females, especially school-aged girls and those above. Mechanical factors, catheterization, sexual intercourse, kidney stones, and improper use of tampons and patches. Letter B. Differentiate lower UTI from upper UTI as to clinical manifestation. The lower UTI is urethritis, while the upper UTI is acute pyelonephritis. How do bacteria reach the kidney? Through the bloodstream and ascending infection from the lower urinary tract or ascending infection. Letter C. Why is urinary tract infection more common in females than in males? Because the female has a shorter urethra than a male, and the proximity of the anal opening to the urethra orifice in females. What is the proper way of collecting the urine specimen? What instructions should be given to the patient when collecting urine sample? Clean by the midstream technique, suprabubis aspiration, diagnostic catheterization, and last from an indwelling catheterization. Letter E. What is possible complication can arise in persons with urethral and repeated urinary tract infections? Chronic kidney infection called pyelonephritis.
Differentiating syphilis from gonorrhea by answering yes or no on the table below. In congenital transmission, the answer in the syphilis is yes. It is congenital transmission. While in gonorrhea, the answer is no, because it is spread through vaginal, anal, and oral sex. In neonatal transmission, under syphilis, the answer is no. While in gonorrhea, the answer is yes. Results from perinatal exposure to the mother's infected cervix. In systemic spread, the answer is both yes, because of the bacteria they carry will spread in the bloodstream. In presence of skin lesions, the answer is both yes. Purulent discharge, the answer is both yes. In syphilis, they usually appear within 4 weeks of exposure, and it is a yellow-green vaginal discharge. And in gonorrhea, a purulent infection caused by Neisseria gonorrhoeae, it is a greenish purulent.
In a patient with HIV infection, what is the specific target of the virus and what will be the effect on the infected person? The specific target of the virus is the cells called CD4 T cells, and it weakens the body's immune system. What is reverse transcriptase, and what is its importance in the management of HIV infection? The virus possesses the enzyme reverse transcriptase that allows it to integrate its genome into the host cell DNA.